people said to us that they wanted services to be more joined up. They said they were surprised that healthcare, social care, hospital, GPs, community didn't really talk to each other as much as they would expect, and so they had to keep repeating themselves, and they found it difficult to navigate their way through the different services that are on offer. So we went about thinking how we could join up those services much better in the interest of the local people. It's been an exciting year for Better Together. We've now got joined up community teams which are much more strengthened than they previously were across the whole of Mid Nottinghamshire, a much more thorough and joined up service in communities, and people are saying they feel much more supported and much better able to live independently. We've also done a lot of really good groundwork for bringing together GP out of hours services with the emergency services in the emergency department at Kingsmill Hospital, but also in the minor injuries unit at Newark Hospital. And over the summer, the building works actually take place to make sure that both departments are brought together at the front of the department. So when you go to the emergency department, instead of trying to work out which door to go in, the professionals will look at what's wrong with you, what services you need, and will make that decision based on your clinical needs. So that will be very different. We're really delighted that we've got our Champions programme up and running now, and we've got some fantastic champions who are really helping us to think through our ideas as they develop and giving some really good challenges to us. We also continue to go out and about, talking to groups, really making sure we don't forget the most vulnerable people in our populations, and so really focusing on some of those individual special groups. So we're trying a whole range of approaches, and we will continue to build on that. We're also bringing online this year a 111 service for health professionals, what we're calling a care navigator. So people, when they've got patients or individuals or carers who need some support, they can ring through to that and get put into the right direction. And it will also save people being admitted to hospital and then quickly having to move around the system, when really it would be better if they got to the right place first time. We're really delighted that the excellent work that's already been happening as part of the Better Together programme has been recognised nationally, and we've been selected to be one of the vanguard sites for taking forward new ways of working and new models of care for the NHS and social care. And ours is one of the most comprehensive in that all of the services are involved. The type of change and the scale of the change that we need is always going to be a challenge. We don't underestimate that, but we have to keep addressing the challenges because this is the right thing to do for our population, and it gives us the best chance to have the best services going forward. We know that bringing together lots of different people from different organisations to work all very focused in one direction based on the needs of the individuals in our population is going to be challenging, because people have different perspectives, different levels of expertise and different cultures, and are used to working in different ways, so that's always going to be a challenge. And we do have to make sure that we get the best value for every single pound that comes into Mid Nottinghamshire, so we get the best possible outcomes for people's health and well-being within the resources that we've got.